Injuries are food for fodder in the world of college football, especially SEC football. And much of the attention has focused on Ole Miss quarterback Bo Wallace. Medical Matters reporter Stephanie Bell Flint has returned from Oxford with the latest not only from Wallace, but also his temporary guardians, a surgeon and a trainer.
Ole Miss quarterback Bo Wallace played the vast majority of last season with a separated shoulder. So you can imagine the damage doctors found and the pain Bo felt.
Sunday mornings were rough. Saturday nights were really rough.
Rough meaning indescribable pain. Dr. William Geissler is Bo's orthopedic surgeon at the University of Mississippi Medical Center.
Basically the shoulder's hanging down, and that's the gap that he had prior to his surgery. So you can imagine with these ligaments torn between these two bones, him taking hits on that top of that every time was quite painful.
But Bo was determined to keep playing during the regular season.
It hurt during the week, but during the game you'd have so much adrenaline going. You know, you're playing in front of 92,000 at LSU. It's not going to hurt too much, you know.
Bo is now in rehab after undergoing an innovative procedure for separated shoulders developed for athletes in contact sports. It's called the lockdown, and it's designed to lower his risk of re-injury.
Just a way to hold the clavicle down, but we also reconstructed his ligaments. So once his ligaments heal, I mean, this should be more of a temporary stabilization. So hopefully this is good for the rest of his life. So this is his x-ray after the surgery. You can obviously see a screw that's here that wasn't before, and this is what's helping place this device around his collarbone and hold it down while the ligaments we reconstructed are healing in. You don't see any elevation at all as we pull down on your shoulder. So your collarbone looks nice and flat.
Head football athletic trainer Coach JERNIGAN is overseeing Bo's rehab twice a day, 5 times a week. He says Bo is showing both commitment and patience.
You can tell football is important to him, and someone that loves football is the best patient.
Even if being the best patient has been a struggle at times.
Just having to keep your mind strong throughout the whole thing, because there's times where, you know, when you first have the surgery that you're just like, man, you know, will I ever be the same? But if I can get this shoulder better and, you know, I can be in there with Coach Warner and study film with him while I'm doing this, I think, you know, I come back just as good as I would have been without the surgery.
Bo says he hasn't thrown a football since his surgery and probably won't until summer. But he says by fall, he plans to be 100%. For Medical Matters, I'm Stephanie Bell Flint.